Happy New Year, Happy New Year, it's Dr. Eric Ibebo. I have my dear friend. This is Mr. Earl. Mr. Earl came to see me from Durham, is that right?
Yeah, Raleigh, yeah.
Raleigh, Durham. So Raleigh, Durham is about an hour and a half away from us, and excited. So met you, when was it? In
January
of last year.
Of last year.
So about a year ago.
About a year.
So Mr. Earl had gastric bypass. How long ago was that?
That was 2008.
2008, he had his first gastric bypass. Of course, like most people, about 80% of people, as time went on, they had to regain the weight, lost the control, didn't feel full anymore, things like that, right?
Correct.
So we did bariatric revision for him, and you've been doing great, right?
Yeah, I'm loving it. I think it was the best decision I made.
Oh, that's awesome. That is awesome. So yeah, we were looking at his weight today, and it's down 64 pounds.
64 pounds.
And listen, don't let this deceive you because there are a lot of muscles in there. I'll tell you what. Yeah, he took off his jacket. I'm like, whoa, okay, now.
Yeah, my concentration was not just on losing the weight, but changing, my body.
Yes, sir. Yes, sir. Well, I tell you what, you were killing it, as I say.
I appreciate it.
Yes, sir. Yes, sir. Indeed. So, as you know, so many people out there have had gastric bypass or gastric sleeve, and like we were talking about, some people don't even know this option exists. So, if somebody's considering doing revision, do you remember how long it took you to get back to work and things like that?
I'll tell you, I think I was very fortunate because really the day after my surgery, I no longer needed any pain pills. I didn't need any nausea medicine.
Very good.
So within 2 or 3 days, I was out and about.
Yep.
And, so it's really non-invasive, and the downtime is unbelievable.
Yes, sir, indeed, and that's exactly what we hear from most people. 2-3 days, most people are back to work. So if you're looking for a non-surgical option for weight loss, come see us. We can help you. Mr. Earl, congratulations, sir.
I appreciate it.
Yes, sir. Thank you.